Hello everyone. I'm Boss Lady and welcome to my channel. On this video, our Nclex review will be on the topic, nursing prioritization and delegation. Remember, you can press the pause button, take time to think out your answer before the right answer is given. Practice timing yourself at your pace.
Are you ready? Moving on to the first question. A patient with a pulmonary embolism is receiving anticoagulation with IV heparin. What instructions would you give the nursing assistant who will help the patient with activities of daily living? Select all that apply. The correct answers are options 1, 2, 3, and 5. Risk for bleeding may arise in any condition that disturbs the closed-circuit integrity of the circulatory system. Bleeding is the primary complication of anticoagulant therapy, and is a risk of all anticoagulants even when maintained within the usual therapeutic ranges. So, all of the chosen options are precautionary measures to prevent tissue trauma and lessens the risk for bleeding. Moving on to the next question. A patient with chronic obstructive pulmonary disease, COPD. Which intervention for airway management should you delegate to a nursing assistant? The correct answer is option 1. Assisting patients with positioning and activities of daily living is within the educational preparation and scope of practice of a nursing assistant. Some examples of tasks and aspects of care that can be delegated legally to non-professional, unlicensed assistive nursing personnel, provided they are competent in these areas, under the direct supervision of the nurse include assistance with transfers, range of motion, feeding, ambulation, and other tasks such as making beds and assisting with bowel and bladder functions. On the other hand, teaching, instructing, and assessing patients all require additional education and skills and are more appropriate for a licensed nurse. So, any option that involves any of these should be avoided. Next question. After a change of shift, you are assigned to care for the following patients. Which patient should you assess first? Before giving the correct answer, we need to understand one important thing about nursing prioritization questions. The priority is always the patient that will die first if his condition is not attended to. Always ask yourself the question: what will kill my patient the fastest? Okay, now the correct answer is option 4. The patient with asthma did not achieve relief from shortness of breath after using the bronchodilator and is at risk for respiratory complications. This patient's needs are more urgent in relation to the other patients. In particular, a patient who is chronically on short-acting beta-2 agonists risks not achieving the same relief from their medicine as they once did. This phenomenon is called receptor downregulation. Next question. An experienced LPN, under the supervision of the team leader RN, is providing nursing care for a patient with a respiratory problem. Which actions are appropriate to the scope of practice of an experienced LPN? Select all that apply. Before I give the correct answers, we should note that, when it comes to delegation questions, the scope of practice of each member of the nursing team must be known and well understood by the registered nurse. If you don't know these different scopes of practice, you will face difficulties delegating tasks in the field, or answer Nclex delegation questions. Now, the correct answer is options 1 and 2. The experienced LPN is capable of gathering data and making observations, including noting breath sounds and performing pulse oximetry. The scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse. Administering medications, such as those delivered via MDIs, is within the scope of practice of the LPN. Next question. The high-pressure alarm on a patient's ventilator goes off. When you enter the room to assess the patient who has ARDS, the oxygen saturation monitor reads 87% and the patient is struggling to sit up. Which action should you take next? First of all, we should understand that the high pressure alarm is triggered when there is increased resistance to airflow. The three main things that mostly cause this resistance for patients who are on a ventilator are: when the turbine of the ventilator is kinked, when the water in the dependent tube is condensed, and when there is mucose plugs. These are the three main things to first check for when you are working on an ICU floor and the high pressure alarm goes off. Now, the correct answer is option 2. Manual ventilation of the patient will allow you to deliver a FiO2 of 100% to the patient while you attempt to determine the cause of the high pressure alarm. Proper ventilation techniques with the BVM should consider safe ventilation parameters for each individual patient and their conditions. Next question. The clinical instructor directed the student nurse to care for a client whose potassium is 6.7 milliequivalent per liter. Which intervention is delegated correctly to the student nurse? The correct answer is option 2. The normal range for potassium is 3.5 to 5 milliequivalent per liter. The client's potassium level is high. Kxalate eliminates potassium from the body through the gastrointestinal system. The right person must be assigned to the right tasks and jobs under the right circumstances. The nurse who assigns the tasks and jobs must then communicate with and direct the person doing the task or job.
We have come to the end of this session as I did not want to make a very long video. Please drop a comment to let me know which topic you want us to review next or you want more on this same topic. Don't forget to like and subscribe to this channel so as to get latest updates. We thank you all. Bye.